And so when we look back at how ADHD has evolved over the years, in the 1700s they referred to kids having an incapacity for attending, or the incapacity of attending. And that was again back in the 1700s. In the 1800s they referred to kids with these types of difficulties as having a deficit of moral control. So if we think about, just kind of hold there for a second, if we think about what is happening societally during these different time frames, back in those days, the expectation was that, and the belief was that children were really just little adults. And that was sort of the case until the 1900s, actually. And so when children were behaving much the same way we think of ADHD kids as behaving, we're thinking that they just don't have the moral control. They have moral deficits that cause them to behave that way because they're not paying attention, they're not following directions, not meeting expectations. Now, in the early 1900s, there was this outbreak of illnesses, encephalopathies. So inflammation of the encephalocele, some of the tissues around the brain. And that causes a lot of emotional, behavioral, medical types of problems. And so what they felt is, and what they referred to symptoms of ADHD, is that they believed that those symptoms were the remnants of an encephalopathy. And so they called it post-encephalitic behavior disorder, because they believed that those symptoms were caused because of the encephalopathy. That was the early 1900s. By the 1930s, we began to recognize that maybe there were kids who didn't have an encephalopathy that were having some of these symptoms, and so they referred to it as hyperkinetic disease of infancy. Now we're starting to finally get into what we really think of as ADHD, hyperkinetic, so they move too much. And again, disease of infancy, so they recognize that it starts early in life. And so we had hyperkinetic disease of infancy in the 1930s. It changed again because in the 1940s and 50s, what we really saw an emergence of is not only psychiatry, but neurology and some of the other more anatomical types of disciplines in mental health, so neurology and psychiatry. And so they called it minimal brain damage, and they felt that these kids had actual damage to their brain. And if we think about the typical ADHD kid, and if we kind of think about ADHD kids today and we kind of put them back in those days, ADHD kids are certainly accident prone. ADHD kids tend to experience minor, if not moderate, head injuries often because they're doing things or jumping off of things or hitting their heads all over the place. And so to believe or to anticipate that some of those kids may have suffered some type of brain damage, again, they were nice enough to call it minimal because it wasn't severe enough to really cause tremendous damage, but damage nonetheless. Within a couple of decades, though, they were like, we really don't like this whole idea of damage, brain damage, so let's just call it brain dysfunction. And so they changed to minimal brain dysfunction. Not really a big difference in what they thought about it, but they took the damage away and they just added dysfunction. Finally, by the 1960s, the American Psychiatric Association sort of creates the Bible from which we make diagnoses. It's a huge book, a very boring read, if I have to say. But they outline all mental illnesses that we recognize, at least in the United States. Other countries do not go by necessarily the DSM, but we do, or it's one tool that we use. So it wasn't until the second edition of the Diagnostic and Statistical Manual that we actually have something, a diagnosis that resembles what we think of as ADHD. At that time it was called hyperkinetic reaction of childhood. So we finally have a formal diagnosis. Up to that time, we have these sort of formal names here, but people called it all kinds of different things. I mean, I think there was an estimate of like 90 different phrases or different terminologies that were used to describe kids with these difficulties up until we had hyperkinetic reaction of childhood. So what the APA finally did was it gave us a common name to use for these. It wasn't until 1980 that we actually get what we think of today as ADHD. They initially called it attention deficit disorder with or without hyperactivity. And then in 87, with the revision of the DSM-3, we have ADHD. Again, much the same, very little difference today than what they had in 1987. It's a very similar diagnosis. Just because to me, this is a fascinating fork in the road as it relates to the history of ADHD. For those of you who are interested in education, back in the 1960s, when we started thinking about ADHD, there were other issues going on around the same time, and medicine and the education system split. At the same time that the APA identified hyperkinetic reaction of childhood, the school system, or the departments of education, first started talking about learning disabilities. Up to that time, they were about the same thing. They thought of learning disabilities and what we now call ADHD as really being the same disorder, the same problem, the same root. And it wasn't until the 1960s, and then more formally in the 1970s, when the Individuals with Disability Education Act came out, and again in the 1980s, or in the late 1960s, when the DSM identified hyperkinetic disorder, that they split. And the school system basically said, there's too many kids with ADHD, we can't manage that. So we're going to take learning disabilities, and medicine, you take ADHD, or what became ADHD. So it's a fascinating split, how that happened, and for those of you with ADHD, kids with ADHD who are in the school system, you know that there are no special education services for kids with ADHD except through the other health impaired exceptionality. And that was more or less done by design, and it wasn't until a little bit later that OHI even allowed ADHD to be included in that exceptionality. So it's a very interesting history, and I took way too long on this, but it was all to kind of illustrate that we think of ADHD as a today problem. When we hear a lot of people talk about ADHD, they say, well, it's the video games, it's media, it's the fast-paced life that we live now, and it's not. It's been around since we've been documenting child behavior, and is going to continue to be around into the foreseeable future as long as we have expectations of kids.